I'm doing well. Thank you.
All right, good.
Appreciate it.
Yeah, welcome to the Black Media Matter Studios.
Thank you for having me.
Yeah, good stuff. So we're talking about something here today. A lot of times we don't. Well, unfortunately, we do talk about death a lot here on this show. We talk about gun violence and things happening out in the city, but something that we don't talk about here a lot is end of life care and hospice care and things like that. And also, usually, if it is talked about, it's never really looked at in a cultural kind of lens. And so, first of all, I'll let you introduce yourself more to our audience here, and then we could talk about your organization and what you guys are trying to do.
Thank you. I appreciate that. So just to give you a little bit of background about myself, I grew up just south of here, graduated from Auburn High School, and, really wanted to pursue something in the social service field and the health field, primarily because of my father's influence. Ended up getting my master's in social work from the University of Oklahoma, got into medical social work, and really wanted to make a difference, especially when it comes to healthcare, since there are a lot of disparities, especially when it comes to like Black health and other underserved groups and populations. And so, the reason that I decided to get into hospice, especially in this part in Seattle, is primarily because there was a need for it. There are over 9 hospices in King County. None are Black governed or Black owned. And I felt like having representation, the governing body, and for the community to be able to see someone who looks like them representing them in healthcare was important, especially at end of life. And especially because of also the cultural component that you just mentioned. Understanding the culture, understanding the importance of cultural relevance, cultural competency. My work as a medical social worker, I've seen cultural incompetency. I know how that impacts Black families. I've been in Black, families' homes, and understanding how people at the top who are, not of the culture, just not being able to relate. And so,
yeah,
I saw the need.
I think that we can even be more blunt about it, in that we already know that there's an empathy gap.
Yeah.
In healthcare across America. And we already know that there's all these perceptions about Black people and their tolerance to pain and everything else. And we also know that, man, we got to advocate for our people, especially when they're in the hospital. And so, like, I spent a lot of time the last 2 years just being present in hospitals, because you get treated a bit differently being Black if people know that you got somebody in the hospital advocating for you, that
Absolutely.
you're not there, that you want to talk to the doctor, you want to talk to the medical professional. That gap is real during the living, you know what I'm saying, when you're fighting for your life for everyday healthcare. I can only imagine what that gap looks like when end of life care. When you talk about some of these examples that you see, what are the disparities or the differences that you see when it comes to Black people and how they're treated in hospices?
So there's just generally a lack of trust. I mean, when you think about the experiences that the Black population has had historically with medical systems, there is justified lack of trust. And so already they're going into the situation. I remember I had a family that specifically asked for a Black nurse because they just have had bad experiences in medical systems and healthcare systems. Well, when they asked for that, they were labeled as being racist for asking for that. And so that just kind of just paints the picture of how misunderstood a lot of Black families are when it comes to, and Black individuals are when it comes to healthcare systems. I'll tell you some other statistics in terms of disparities. Specifically, we're talking about the Black elderly population, right? The Black elderly population in America, and this is by the Kaiser Foundation. They came out with this information. Out of any other people group, visited the ER department of hospitals the most, had the most hospital admissions, and also have the most hospital readmissions. And a lot of these folks that are going through this are people that are dealing with terminal illness, that are at end of life, and that should be and would be getting hospice care. And so it's those factors that made me realize, okay, I got to do something. And if I'm going to do it, I got to do it my way. And I partnered up with David Turner, a mentor of mine who had done hospices in Michigan and Tennessee, and just wanted to do something that was Black governed so that people saw representation, so that people could have trust and know, okay, people on the other side look like me and they represent me and are able to empathize, like you said earlier.
Yeah, I mean, more than anything in the life, you need people who one, value your humanity and
Absolutely.
see you as a whole person, and two, of course, empathy is real important. You get lots of sympathy, but empathy. So what's the landscape like now? You said that there's 9 hospices that are operating here in King County. Your hope is to become a number 10. Right. What is that process like to go? And maybe you can explain to everybody where you guys are at in this process.
Okay. Well, I'll just kind of keep it short. Right now, the state is looking at 4 applicants. We're one of those applicants. And the state is going to be giving 2 certificates. So only 2 of the 4 are going to be operating and established in the future. And we're letting the state know, hey, you got to have somebody like us that has grassroots existence. We work with the community. We have relationships with churches. We have the support of churches. We have the support of Black organizations, the Urban League of Metropolitan Seattle, the NAACP, their health committee, the chapter in Seattle, King County. I mean, I could go on. We've built relationships and we've let people know grassroots wise the reason and the need for something like what we have to provide. And we're wanting to let the state know, hey, we're going to be able to address disparities that exist that they're well aware of.
Wow. Yeah, I know my buddy, Ashley McGirt, she does the Washington Therapy Fund as well as a private practice. But before that, she was a social worker at a hospice. And she was telling us how even the way that sometimes things are communicated to Black people in the hospice and the words that they were using, you know what I'm saying? Well, man, do you want your pain to end? You know what I'm saying? They ask these kind of questions that most people be like, yeah, that alters the trajectory of the end of life care.
Right.
Maybe you can expand on that.
Yeah. The thing is that a lot of families, a lot of individuals are getting some of the same thing that they've always received in terms of healthcare, and that is, things that are done to further exasperate that lack of trust that I was talking about. And so, and that's why representation is important. When they see a doctor, and this has been proven by data, when a Black person sees a Black doctor on the other side, there's a greater level of trust. When they see a provider or healthcare system that is Black governed or Black owned, there is improved outcomes and just a better sense of trust there. And so, and one thing I would tell you is that the decision that the Certificate of Need program, they're the ones that approve hospices, and they're a part of the DOH. The decision that they're making is based on a legislation that already points out that applicants should be prioritized based on their work with special populations. And the way the special populations in that legislation is spelled out includes racial and ethnic minorities. And so the legislation is there supporting us. We just want to make sure the Department of Health also is believing in what we are intending on doing.
All right. So this is a decision that comes out of Olympia. And what you're saying is there's 2 licenses for hospices available. There's 4 applicants. You're the only applicant that's serving that would serve our community, people that look like us or kind of like us. And when are they supposed to be making a decision on this?
So just to add on to what you just said, we're the only applicant, and historically, there's never been an applicant that has come out and said we are here for the Black community. So this is unprecedented. We have an attorney that's looked into previous decisions that the Certificate of Need program has made, and none has been based on the premise that we are coming with, which is we are here for the Black community. And so we are first, and we are wanting to make sure the Department of Health prioritizes us in the way that the legislation says that they should do.
So what I hear you saying is it basically y'all the first Black folk to go down there and apply for a hospice as well.
And this is why it's important, is because this is about Black-owned healthcare, not just in hospice, but in healthcare in general. We are trying to get into a space that we've never really been given the room to exist in, especially Black governed. I mean, you know how it is. In the 1940s, there were over 120 Black governed, Black-owned hospitals. Right now, Howard Medical Center, Howard University Medical Center is the only one. And so it's historically been shown that there's space for Black-owned healthcare has been limited and has tapered, I mean, drastically. And so we're wanting to make sure that we represent not just hospice, but Black-owned healthcare.
Man, I'm gonna be honest with you. That this is something that needs to happen. Well, even more than that, I will say that this presents an opportunity for the state of Washington under the guidance of our Governor Inslee, who last year released the equity bill, you know what I'm saying, and wanted to put money in places to be able to really repair rations of the past and be able to build a firm foundation for the future. But, you know, I'm always one who says a lot that, like, money comes and goes, but policies. And so sometimes, you know, the money be out there, but it's out of a smoke screen because money disappears or community fights over it, but no policy has changed. I think that this presents a perfect opportunity for the powers that be down in Olympia to actually use policy to match their words about equity and access, right? Because a lot, you know, people use money, they print more money, they get more money out, but a policy change. So this is actually an opportunity for a historic opportunity for the state of Washington, a historic opportunity here, and also for their actions to match their words, right?
Right. For their actions to match what's said in the legislation already. Priority should be made to applicants that are emphasizing and are focusing on special populations, i.e. Racial and ethnic minorities.
Yeah, Sean, who we need to talk to down in Olympia, man?
Well, so I'll tell you this, just to let the public know, two things. One is there is an article that the South Seattle Emerald wrote about us, and they did contact the state Department of Health and the Certificate of Need program, and you can read about it and the response that the state gave them. That link is available, right, for our viewers. So I'll say that, and then the next thing I want to say is there is an email address that you could write if you want to advocate for Black-owned healthcare, if you want to advocate for us, and you want to see representation in healthcare on the other side of healthcare when it comes to providers and those that are providing care in the community. Then I'd say write to the Department of Health and let them know, hey, we're aware that there's a hospice that is trying to come into King County to serve an underserved population, and they need to be approved if they meet the criteria. And we feel like we meet the criteria in terms of what the state is looking at.
Right. And so Shalman has put that email address there in the comments, and you need to refresh the audience the name of your organization.
It's YBG Healthcare. It's YBG Healthcare, and it is basically we're going to be DBA Heart and Soul Hospice, but it's YBG Healthcare that is applying with the state right now.
Right. So what I would say is this: you know, we got a lot of activists who follow Converge, and they stay active there in the comment. I'm sure somebody in there already got their email browser open. And man, let the state of Washington know. I mean, one thing is for sure is in dealing with government, if you don't make no noise, you can have no expectation for anything to happen. So if representation in healthcare and representation in that field and representation in end of life care is important to you, if it's important to your family members, I know we have people in our audience, our listening audience, who've had family members go through hospice, and you know, and it's real, it's intense. And you sit there and, you know, I mean, you literally
watch your loved one pass away. And when people have an absence of humanity as life is leaving the human body, when people can't see you as whole and treat you as whole and treat you as just human, you know, some of our elders have lived their whole life. Some of our elders have lived their whole life in this country, and from birth to death, been shown no respect, been shown no dignity. And man, if we can find a space where in their final days they can be shown some humanity and dignity, then that's what we need to do.
Absolutely. I mean, I can't really say any more than what you said. And the thing is that the ability to be able to show empathy and the ability to be able to culturally relate. That's something that in my experience with my father at end of life care that we lacked, was that cultural competence. And I don't want that to be a memory of how he passed, but that is the fact. And that's one of the reasons I think our existence is important, is because we're not going to mess it up at the end of life for families. We're going to relate to them, and we're going to meet them where they're at and their cultural, what they expect culturally, as opposed to violating it.
Yeah, and if anyone in the viewing audience, if you've never had a loved one transition through hospice, it's important that not only in the care given to the loved one, but the care that's given to the family.
Mm-hmm.
You know what I'm saying? It's something. I'll say that. And you know, it's something when you see your loved ones pass away and they've reached a point, really, of no return. And now they're on God's time. And all we can do is provide comfort and care, you know, and understanding and respect and dignity. Man, I don't know. I mean, it just caught me here for a second, because I just think about so many of our elders who leave this earth, you know, who never called sir or ma'am their whole life.
Yeah.
Was at colored water fountains.
Yeah.
And here at end of life, to be able to give them some dignity, man, y'all need to get active out there. That email address, y'all need to email, y'all need to talk to DOH. It's very rare on air that you'll ever hear me advocate for any. We get politicians on here, we get all kinds of people on here. I'm like, yeah, just go vote. I'm gonna tell people, go vote for this or go vote that. But on this, I'm gonna tell you, this is something that we need.
Yeah.
We need this in our community. We need this care. Y'all need to let your fingers do the talking and send an email. Y'all need to reach out to DOH. You need to let people know that, man, this needs to happen.
Absolutely. And you know what I want everybody to know also is that the people that we have leading this hospice project, you know, I mentioned, obviously you know me, but David Turner and Dr. Carla Ainsworth, our medical director, these are people that have been in hospice for a long time. You know, you're not dealing with amateurs. You're dealing with people that understand the disparities in hospice, that understand what Omari was just talking about, the experiences that Black individuals in this country have had in healthcare systems and how they've been wronged, and how with our project at end of life, we're going to try to make sure that we get it right because of everything that they've been through. And I'm not just talking about in terms of hospitals, even outside. I'll tell you this. I went to the University of Oklahoma for my master's in social work. The University of Oklahoma Medical Center was built on homes taken away from Black families. Over 600 homes were removed to build a medical center. So it's not even really what people have experienced in hospitals. It's what people have experienced in terms of their homes being taken away for a hospital to be built. How could you go to that hospital if that hospital was built on where your home existed? So we're talking about that kind of mistreatment and injustices that people have experienced in healthcare systems. And we're trying to get it right at end of life with our project. And so that's what we're about.
Yeah, man, for reals. So Salman has put the link. Our partners over at the South Seattle Emerald, they actually wrote an article here, and it was actually the South Seattle Emerald who connected us.
Marcus, yes.
They really felt that this was a really important enough story that we wanted to amplify it across all of our platforms. Email address is in there as well. What's the deadline or decision date for this?
So we have a public hearing coming up May 5th, and then they're going to make a decision. They are estimating at the end of August of this year. So August 2022. And so we have, about 4 months before we find out.
All right. And is there a public hearing on this at all? Or how does that kind of stuff operate?
So the public hearing is really kind of, they send out an invitation, and we get to present our project along with the other applicants.
All right. So it isn't the general public, it's you presenting and your presentation being available to the public.
Right. And it's kind of who the certificate of need department kind of invites. And the way that whole thing was set up even is just not really accessible for the community. It's on a Thursday morning at 9 a.m. Microsoft Teams, weekday. It just kind of I wasn't really comfortable with that. But at the end of the day, I feel passionate about what we're doing, and it doesn't matter what time they set those type of things. I feel like we have the support, and doing things like what we're doing now will kind of propel us.
Well, yeah, and I'll say this is that the Department of Health in the state of Washington. Now, this is the Department of Health. They got a campaign. You see right here. That's the hereforwhy.org. That's coming from the Department of Health, because the Department of Health recognize disparities within the Black community with COVID response, and so and people taking the vaccine. So the Department of Health has already shown that if something is important, it's important for a Black community here, and what they've shown here was around the vaccine. They mobilized the whole campaign. There's TV commercials, there's events. We did a special. There's advertising everywhere else. So clearly the Department of Health is able to look at specific populations here in the state of Washington and be able to take that into consideration and literally put money where their mouth is and be able to create policy to be able to reach specific audiences. That's what's happening right now with hereforuswhy.org. That's out of the Department of Health. So, brother, I stand here optimistic that the same people there at the Department of Health in Olympia will realize that this as well is a specific need for our community and community of colors for death with dignity. Absolutely. In hospices in our community. So you know what I'm saying? We want to empower the Department of Health to continue upon this road they're on. They're off to a great start with what they're doing around hereforuswhy.org, and they've shown that they're able to look at data and everything else and make responsive decisions. And man, let's hope that they look at this situation like that as well.
Absolutely. And like you said, it's time. And it's one of those things where we need more Black-owned healthcare. If we want to change health outcomes, not just the end of life in terms of end of life care, obviously that's more palliative care and not aggressive care, but in general, for people to have better access to healthcare, you just need more Black-owned healthcare. I believe that is the solution.
Man, that's just dope. We just need more Black-owned. I like that too. My mama used to always say, "We ain't begging, we buying." And we need to be out of a system where we begging all the time, and we need to go where we're treated, with this level of respect and this level of dignity, and it's important, and that work is important. You could go ahead and let people know, man, if they want to support, or if they want to reach out to you, if they want more information, man, how can people catch up with you?
That's a good question. One of the things that we really can't have or don't have, because we're not an established hospice agency, we can't really publicize our information like we're established. So we don't have a website or anything, just because, again, we've not been approved yet. But one thing I would tell in terms of people reaching out, doing something, is send an email to the Certificate of Need program at Department of Health. that I think that email, like I said earlier, is available, and let them know that is the best way to support what we're doing, and to let the health department know that the community's voice counts. The community has to have input in the decision that the Department of Health is making about King County. So if you live in King County, let your voice be heard. So I appreciate you asking for that.
Yeah, no, it's all good. Man, people who watch Converge, we love our elders over here. It's and I know hospice is across, you know what I'm saying? People were terminal, but man, we love our elders over here. And it'd be two things that really get us to move. And that's it, our young people and our elders. We cherish and value our elders. And there's an old African proverb that says every time an elder passes away, it's like a library burns to the ground. And man, anything that we can do that in the last days, our elders, that they're here, that we can provide the best care and comfort and support and respect, man, I'm with it.
Absolutely. And I really want to, let people know and challenge people to really look into the data and numbers, and look at how the Black elder population is being impacted, whether it's COVID, whether it's healthcare, whether it's other different areas. Get interested, because there are a lot of disparities. They're an at-risk group in several areas, not just in health. I'm talking about the Black elder population. And like you said, we should care enough. And part of caring means studying, looking at the data, looking at what statistics say, and where can you help? What can you do to make a difference within that population?
Hey, man, it was a strength of Big Mama and them that got us here. You know what I'm saying? And it's like we owe that generation, like you said, to get involved. And really, when you look at it, and you could, excuse me, you could imagine, we always say when America sneezes, Black people catch a cold. And, the impacts, the disparities are real. And, one of the things here, because of our smaller population, we talked about this with COVID, a lot of times we live isolated here in Seattle and in King County, because we don't see that actual impact like you see down there in Oklahoma or South Carolina or North Carolina or Mississippi or Alabama, and you see the state of things, and people here wouldn't believe it. Listen, man, I want to thank you for taking the time to join us this morning. I want to thank you for informing our audience, and also for giving them a call to action. Our audience loves a challenge. We've now challenged them to make their voice heard down there in Olympia.
I appreciate you for having me, and I appreciate you for caring and for just showing the emotion and the sincerity. And we're in this together, and I'm really grateful for this opportunity.
Yeah, no doubt. And about our elders, man, I'm always gonna care. Converge is always gonna care.